Welcome to Fox TV News, where everything is true. My child never deserved this. Doctor didn't help as 17-year-old grasping for air dies, mom says. The only money Narda McKay had in her purse was her 17-year-old daughter's college tuition, but she would have spent every cent without hesitation Friday night for some oxygen at the University Hospital of the West Indies UHWI, where she had pleaded her guts out for help for nearly 2 hours. No help came, McCoy said, and her daughter, Jalissa McGowan, who had ambitions of becoming a visual artist, slipped from her arms, turning her world upside down. An intensive investigation has been launched into Jalissa's death, and the findings will be disclosed thereafter, said Dr. Peter Glange, senior legal officer at the hospital on Sunday. McCoy's nightmare began sometime after 9 p.m. Friday. McGowan, who she said was asthmatic, complained of feeling tiredness in her chest. The Bedward Gardens St. Andrew resident said she immediately sprang into action and got her husband to transport them to the nearby UHWI. McCoy said that a doctor kept her distant while assessing and gathering information on Jalissa, who was at the time weak and she was struggling for air. As her anxiety spiraled, the forlorn mother said the doctor returned with news that she had no bed space to offer Jalissa's oxygen. An assistant said to her, "But we could hook her up here because there is a big oxygen tank over there," a teary-eyed McCoy said. The assessment doctor said no, she cannot do it because the last time she did it, she got in trouble. She walked away. McCoy, who has a younger daughter, said that her appeals to administer oxygen, even in a corner, to stabilize Jalissa were met with ambivalence. Nearly an hour had reportedly passed, and by this time, she twice visited the emergency area of the hospital, but no assistant came from the medical staff. It was a security guard who offered some comfort and encouragement as young Jalissa fought desperately to breathe. Her desperate attempt to keep her eldest daughter alive were being aided by 2 small inhalers when she squeezed until they were empty. The same doctor pushed out her head and said, "Puff her some more," McCoy recalled. Jalissa, she said, had gone unconscious, the first sign that time was running out. Maternal instinct drove to host her again for help from the emergency room. "Me say, somebody come help me now. Who can help? Who is going to help me?" Nobody came. McCoy and her husband eventually transferred the 17-year-old to Andrews Memorial Hospital, where she was pronounced dead. "It looked like an inna me hand she dead. Inna me hand she dead. My child never deserved this," the grief-stricken mother lamented. In the same breath, she praised the staff at Andrews Memorial, who she said did not hesitate to render assistance when they arrived. "Picking up the pieces is going to be very difficult for McCoy. From morning me get up, it's like me in a daze. Me I wonder if me must blame myself," McCoy, a teaching assistant completing her degree at Shortwood Teachers College, reported as she clutched a blanket in her hand she had wrapped Jalissa in her time of distress. "No, 17-year-old just gone so." She vowed never to wash the blanket, fearing the memories of the night she had cuddled her daughter for the last time would fade away. Jalissa's death has had a devastating impact on her extended family, McCoy said, especially on an aunt who lives overseas. "She mashed up her phone. She said she's going to commit suicide," McCoy said before bursting into tears again. "She went to a nearby park, and my other sister had to call cops to get her because they didn't want that to happen. They held onto her, and she has to stay in a mental facility for 72 hours. Health Ministry launches surge plan to tackle hospital challenges. The Ministry of Health and Wellness is now implementing its surge plan that has been developed to respond to the increased levels of hospitalization due to the COVID-19 spike. The surge plan is to entail the expansion of bed capacities at several of the island's hospitals and the employment of medical personnel to deal with the pressure of the health system. Speaking at Sunday's virtual press conference, Health and Wellness Minister Dr. Christopher Tufton painted a grim picture of the reality now plaguing the island's health system. As of today, February 28, we are realizing a hospitalization rate of 7%. That is, of the total number of persons who are COVID-19 positive, approximately 7% are serious enough to require hospitalization, he stated. Tufton revealed there is now an average of 48 admissions per day of COVID-19 patients across all the island's hospitals. Based on the epidemiological data, we are averaging an infection rate of 1.3, which means that every person infected with COVID-19 will infect at least 1.3 others. If this rate is not reduced, we will continue to see a rise in the infections and an increase in the number of persons who are hospitalized, the minister emphasized. Additionally, as at February 26, all hospital beds that are currently dedicated to COVID-19 isolation are full, he reported. In response to these alarming situations now emerging within the hospitals, Tufton said that the surge plan will entail the expansion of hospital bed capacities. He disclosed that the St. Joseph Hospital COVID-19 ward with 36 beds is now in operation with an occupancy of 8 persons. As the weeks move on, we will admit more patients to this ward based on the course of the infection rate, he advised. In relation to the Falmouth Hospital COVID-19 ward, it is fully equipped with 36 beds available. It will begin to admit patients on Thursday, March 4. For the field hospital that was donated by the United States, Tufton said it will now be housed on the Spanish Town Hospital grounds, where the 40 beds will be used to support patients in that facility who are suffering from COVID-19. At the University Hospital of the West Indies, UHWI, the management there has now completed the conversion of an additional ward with some 26 beds allotted for the admission of COVID-19 patients. Importantly, Tufton stated that a public-private sector partnership with Andrews Memorial Hospital has resulted in 15-bed non-COVID facility that has been established at that hospital. It will take some of the pressures off the regular hospital system in the corporate era so that we can dedicate more time to COVID support, he added. In relation to the human resource support needed within the health system at this time, the minister announced that in the Western Region Health Authority WRHA, 18 additional temporary doctors have been approved, with 6 receiving contracts to start on Monday, March 1. Additionally, 42 nurses, assistant nurses, and patient care assistants are being hired, with some 14 being interviewed on Monday, March 1. The WRHA comprises the parish of St. James, Trelawney, Hanover, and Westmoreland. For the Southeast Regional Health Authority SERHA, comprising of the parishes of Kingston, St. Andrew, St. Thomas, and St. Catherine, 43 additional temporary doctors have been approved, with 4 receiving contracts to start on Monday, March 1. In addition, 236 nurses, assistant nurses, and patient care assistants are being hired, with contracts being finalized for deployment within the next 2 weeks. Meanwhile, Tufton said the health sector also faces a real challenge with the mass recruitment of public health personnel for work overseas. He said the UHWI, for example, has lost some 70 nurses since the start of the year. The nurses have been recruited by other countries paying more attractive salaries, he said. That is adding to the pressure of the health system and contributing to the lack of personnel to deal with the challenges we face, the minister added. Some Jamaicans taking COVID-19 pandemic for granted. Prime Minister Andrew Holness says many Jamaicans have started to take the COVID-19 pandemic for granted, forcing the government to now act by implementing stricter control measures. Speaking at a virtual press conference, Holness painted a picture of the nation's hospital now being threatened due to the number of persons with the virus requiring treatment. Unfortunately, too many of our brothers and sisters are beginning to take the pandemic for granted. Many of them feel that it is not a personal threat to them or their loved ones, Holness indicated. Therefore, while we have managed to keep the case fatality rate below 2%, once the capacity of the health system becomes threatened, we could see a spike of not only the numbers affected, but also in those dying from the disease. This is therefore the critical fulcrum on which balance is maintained, and as it is now, We have to shift our policy efforts so that we can preserve every Jamaican's life, he argued. A raft of new COVID control policies has since been detailed by the Prime Minister. For his part, Health and Wellness Minister Dr. Christopher Tufton disclosed that the hospitalization rate for COVID-19 patients is at 7%. Please remember to subscribe, like, share, and click the notification bell for daily updates.